This is Ralph LaForge. I'm actually in Albuquerque on a project in New Mexico that involves camera work, but my other job, of course, is lipids and diabetes prevention. Anyway, welcome to LipidPALOOZA. Just would like to begin to thank you for all of the sponsors. My goodness, there's quite a few of them. Very much ingratiated to them. And I would like to introduce the topic that I have suggested for this webinar, and that is objective and practical measures of physical activity for clinicians, especially busy clinicians. Just as a reminder, send your questions and answers in real time when you can, and write those in, and I'll answer as many as I can. And if I don't, you can use my email, which I think will be given to you. If not, I'll give it to you at the very end, and I'll answer your questions by email because we have a fairly short time period here. Okay, let's get started here. Let's see, the two things that that are immediately relevant to what I'm doing now is I'm still adjunct instructor at Duke University in the Endocrine Division, and I work with the Alaskan Native Health Consortium for both physical activity and clinical lipid registry. But what's taking up probably 50% of my time in the last 4 years is I'm a Nikon professional photographer on assignment. Right now I'm in Albuquerque, got an assignment in Placitas and Las Cruces tomorrow. So a little bit of camera work along the way. So why record physical activity? I'll answer that in one slide right after this, but we'll talk about, of course, that. Example tracking methods, we'll spend most of the time there. And the targets, and then how these targets and the outcomes of patient physical activity movements, including step count, etc., fit into EMR and virtual patient room platforms, which is what I'm more involved with, at least with Alaskan Natives. And many of you have seen this before in my presentations, but it has never changed. Every step that is measured is an AMP kinase activation, aminophosphate kinase activation, which is sort of underscores how many drugs work, especially diabetes drugs work in terms of immediate access to improving insulin sensitization and many other benefits. Every single step. And you can make that complex, but when you see a step count on a pedometer or an accelerometer, you're basically counting very small aliquots of AMP kinase. And that has never changed. And as simple as that is, the bottom line to that is really move and move often, period. So, objective measures of physical activity. We'll talk about the first two and the last two. Accomplished behaviors, patient self-report. I'm going to show you one that's worked well for us in Alaska. Pedometers, of course, and then we'll talk about fitness trackers and smartphone applications. We'll talk quite a bit about smartphone applications because in the last 3 years, the chipsets on smartphones are unbelievable. I'll get into that. I don't want to start now. I would never finish. Okay, so let's talk a little bit about how, if you're going to, in a very practical, utilitarian way, how can you have a patient report back to you physical activity in terms of accomplished behaviors? Well, a program we started 9 years ago for Alaskan Natives and American Indians was the gym inside your door. That is what you can do at home, and as long as you can measure it or gauge it, that has outcomes measured. That has direct benefit for energy expenditure and ultimately insulin sensitization and lipid management. This is actually the Facebook page of that program. Although I don't have a whole lot of time to discuss it, it's a day-long instruction program for providers. The bottom line is that the provider has a prescription sheet and that provider writes into each of those 7 or 8 boxes around this circle activities that need to be accomplished at home, would it be sweeping, washing, pulling, gardening, cleaning, scrubbing, whatever, after taking a very quick inventory of what can happen at home, is written into this, and then the patient goes from one of those activities to the next one, only taking 1 or 2 minutes in between, such that after 60 to 90 minutes, they've expended by at least 2 studies that show actual measured energy expenditure, double labeled water measures that would be up to about 300 to 400 calories, depending on the body weight of the patient and the length of the circuit. So actual activities that are accomplished in some objective way and then reported back to the clinician, and such that this would be done at least every other day, if not every single day. Now, activity tracking methodologies come in many forms, as you can imagine. The top left, I'm afraid to use the arrow thing because I think I'll mess it up, so you'll have to just bear with me. The top left is a GXT3. It's the actigraph accelerometer, about almost $1,000, that measures activity in all 3 planes, X, Y, and Z axis. Very accurate, used for many research studies. Isn't it interesting, though? In the bottom right, when you look at cell phones, they are now using the latest in the last 2 years. Many cell phones are using the same chip the actigraph has, are very similar. And, of course, you have multi-use of a cell phone, not just for activity. So, and then, of course, you have pedometers and wrist-worn devices, etc. So pedometers, wrist-worn devices, mobile apps, these all, once we collect the data or have the patient collect the data, the bottom line is having the patient report that back to us either virtually, EMR-wise, or, of course, in a clinic visit, which is probably not going to happen anytime real soon. I've used pedometer and tracking mechanisms on kids for many years, or I've had providers do it. In pre-diabetic children, these are Alaskan Eskimo children that in Barrow, Alaska, this is about a decade-old slide, but very easy to do. And they were just using very small, simplified, but well-engineered pedometers, which work quite well. There are wearable devices that are quite impressive these days, that you can only imagine. I bet you half of the people listening to this have a wearable device, like a Fitbit. There's been numerous reviews on wearable devices over the years. A friend of mine, Karen Evanson from UNC Chapel Hill, reviewed 22 studies a couple of years ago, and there's been several since then, but they all say the same thing. When you look longitudinally at these various devices and their ability to measure activity, energy expenditure, distance, that type of thing, they all do best at measuring step, not quite as good at measuring caloric expenditure, and not quite as good at measuring distance, although they all somewhat correlate. Steps still are the bottom line, as many times as I've said that in past seminars. Another, Haruka Murakami, who, my goodness, this man started in Tokyo, just out of Tokyo, in Yamagata, Japan, 25 years ago, the 10,000 step protocol. And he's still at it. He looked at, this is just the variances you see in wearable devices in their ability to predict, and they don't really measure it, to predict energy expenditure, caloric expenditure. They're pretty much all over the map, with several of the wearable devices that are better than others in terms of either under-predicting energy expenditure or over-predicting energy expenditure with double label water method, which is the sort of bottom line when you look at elimination rates of deuterium and oxygen 18, which may sound complex, but that's the gold standard measuring energy expenditure over a given period of time. Anyway, they're not very accurate measuring. There's been numerous other studies that have looked at wearable devices all at the same time. Can you only imagine this? I won't go into great detail here, but just look at the Nike Fuel, the Jawbone, the Fitbit One, the iFit, and the Strive Play. Look at the variances in the entire, basically over the course of a day, from 8,000 to 16,000 plus step differences. So it doesn't, as long as you stay with the same device through the course of care, it's probably it just shows changes in activity patterns. But if you're looking and mixing and matching various devices, you're going to get apples and lemons. I mean, really, artichokes and oranges, it's not going to be even close. And we've seen that on day 2 when that same study looked at when the patients were using their arms more in a particular, more quantified 12 hours of the wakeful day, you still saw quite a disparity from anywhere from 8,900 to 12,100 steps, even using the arms, unless it was an arm-worn device. The arm-worn device sometimes will overlap step count with the foot strikes. So it's a lot of noise and probably doesn't have a lot of utility on reporting measures, at least from a medical standpoint. The Fitbit Charge is one of the first, and I don't know how utilitarian this really is, but it was the first to have a treadmill mode. Now, a treadmill mode is nothing more than when you open that mode on the wrist-worn activity tracker, it disengages the GPS. Otherwise, every time you step, most of the wrist-worn pedometers have GPS, and they're looking to track your distance, but as well as your walking or running route, or even biking route these days. It disengages that, so it's supposed to be more accurate. So I don't think it's a real big deal for having a treadmill mode. Beyond steps, my gosh, the Apple Watch 6, which just came out for about $500, includes 42 parameters, including oxygen sensing or oximetry by touch, and an EKG, which is basically a lead one touch simplified R2R complex, PQRST complex. How great these are from diagnostic or follow-up standpoint, I don't know, although Apple and other competitors are using the O2 sensing device for COVID patients, or at least studies to see if they can predict changes in energy expenditure, physical activity, and oxygen saturation with SARS COVID patients. So it may turn out that may have some utility. And I won't spend a lot of time on Fokima's study out of the Netherlands, other than some wrist-worn and even pedometer-type devices and arm-worn devices are better at measuring faster walking speeds. In fact, if you have a patient that's elderly and shuffles along at less than 1 mile an hour, except for the new chips in iPhones and Androids, pedometers aren't going to justify, and most wrist-worn devices are not going to justify real-time and reliable step counts. So you need to walk, as a general rule, when you look at all the data, it seems to be around at least 1.5 to 2 miles an hour is probably or faster, better if it's faster, is more accurate step counts. So the key point in this is employ the same device recording method through the course of care, regardless of which you use, wrist-worn, pedometer, cell phone. The most important thing is have reliable validity and consistency in the device being used. Let's talk a moment about cell phone pedometers and steppers that are in the chips in the cell phones. And it's interesting because most cell phones use almost identical chips now for this. If you look at what these chips in smartphones use, steps, distance, location, route, and route planning, energy expenditure, which is prediction, body composition, which is a real prediction, heart rate, route mapping, and as you already saw, oxygen sensing and EKG. So it's really the steps. You can spend $500 or $600, but you shouldn't have much variation in the reliability of the device to measure steps or foot strikes in this case. So let's talk about some of the fitness apps. We'll talk only about two really, and that would be Google and iPhone and Apple. Google Fit has a platform. This takes up only about 15% of the cell phone, yet this is a miracle. That centerpiece you see in this circuit board is the gyroscope, and the addition of a gyroscope to new chipsets for smartphones in the last year and a half improved the accuracy of acceleration. I mean, small accelerations. In other words, it gives you more objective results with small movements, even though if they're very low energy expenditure movements. So this is the centerpiece of the accelerometer in a cell phone. It's only about 5 millimeters across. It measures movement in all three planes, X, Y, and Z axis. It does that with piezoelectric physics, piezoelectric crystals, which are extremely small, very sensitive to movement in any plane. And it has a 3-axis gyroscope and magnetometer. Most new cell phones now, iPhones or Androids, include magnetometers, which have now improved GPS sensing and route planning sensing. So it just, who knows where we're going to be 10 years from now with all this. So this is just a close-up of the gyroscope chip in one of the new, I think this was the iPhone 10. So as you can see, the sensors in cell phones measure well beyond steps. We can really get distracted with all this information, and maybe that's good in some cases, and maybe it's just anxiety provoking in others. But I would rather you dumb it down to just the movements. And secondarily to that, if it gives you a distance and mileage or time spent in activity, that's fine too. Very quickly, let's look at the platform of Google Fit versus Apple Health. Here's a Google Fit Android phone, many types of Androids. But when you download the Google Fit app, you, just like Apple's, you can look at movements per day, steps per day, and keep in mind from a clinical standpoint, all of this can be registered over the course of 6 months to a year. In other words, when a patient reports back in a virtual room, EMR, or a live visit, they can download this for the physician and how many movements they've had since the last visit. So the ability to record movements over time is exceedingly important. And the same with iPhone users and MyFitnessPal, and there are other fitness platforms with iPhones. It do the same thing, different format, just comes down to the graphics you like most. Now, the last 3 years, and I missed this year because of COVID, as a photographer, I do a lot of hiking. Cornwall, the Southwest Coastal Trail, the Camino de Santiago, Cotswold in England, where my wife often accompanied me. We'd be walking anywhere from 90 to 300 miles in a single trek, of course, stopping overnight. But what I decided to do several years ago, and especially which one of the most beautiful trails is the Southwest Coastal Trail of Cornwall, England, southwestern part of England. And the reason I did this, I wanted to compare the Google phone, an Android phone, with a simple 2720 AccuSplit pedometer over the course of the entire trek, okay? This is my wife in front of me that's actually doing the measurement. I have too many cameras, I can't do anything else, but you can see how beautiful it was. But the main thing, over variable terrain, over a long distance. In this particular trek, the Cornwall Southwest Coastal Path, this trek that we did was 155 miles in 17. within 3% of each other. The Google Fit and AccuSplit 2720 pedometer, almost identical. And for about 1/100th, well, heck, it's probably more like 1/1000th of the price. Well, not that much of a ratio, but much less expensive if just measuring step counts than 2720. So that's a lesson. The simplicity of it all is going for just the steps. If you want to know distance, which is a lot of fun when you're doing hiking and whatnot, that certainly adds benefit, fun, and motivation, I might add. And this is Betsy with the 2720 and the Android phone and that Cornwall walk. Okay, what should we be doing? It really is the change for your patients. It's whatever they were doing, 2,500 steps a day, and the next visit. It's the change in steps that probably have the most reliability in relationship to improved health overall. But ideally, depending on the age and the height of the person, 10,000 steps per day seems to be still pretty reliable for most people, even after 2.5 decades of the 10,000 steps program being launched. If you want to get an idea of what step count looks like in terms of LDL and body fat reduction, this is from left to right here, from 500 to 2,500 on the horizontal axis. This is caloric expenditure over the course of a week. The middle blue arrow just shows at least 1,500 calories per week minimum to have for most people, measurable body fat loss and or LDL reduction. And then if you translated the 1,500 to 2,000 calories of exercise a week to step counts per week, now this is an average. You would have to add 40 to 50,000 more steps per week than your sedentary lifestyle. A sedentary lifestyle index for a week is less than 3,500 steps. I'm sorry, 35,000 steps per week or less is the CDC's threshold for being sedentary, or 5,000 steps per day or less. Whatever that baseline is, you need to add 40 to 50,000, if not more. So the total step count, including activities of daily living, is at least 70,000 steps per day, including, 70,000 steps per week to get measurable changes in adiposity and LDL and triglycerides and a number of other variables. So just to give that some meaning there. Finally, if we're going to chart this, it's going to be hard to do that live because of not having live visits for most of us now. So EMR is probably the best way when patients report virtually. In the Alaska Native Consortium in Anchorage in Alaska, we use virtual patient rooms. And VODA stands for Virtual On Demand App, where a provider can actually on demand, on schedule 4 or 5 patients to input their weekly step count or monthly step count or daily step count into the window as a group. Or in that case, and this is just the platform we use for the AFH, means the Alaska Federal Health Partnership for Alaska Natives. A patient can independently have a iPhone or Android report directly their step count to the virtual window, to their chart. That's new. We're still in the beta testing of that, but it won't be long where the provider can look right into the charts exactly what's happening with the patient. Okay, as I wind up here, steps are the most important, distance less reliable, and energy expenditure least reliable, regardless of what method you are using. Fortunately, steps are probably the most important from a health benefit standpoint. So to summarize, stay with the same methodology, the course of care. Total weekly step count is the primary reporting measure. Just move and have your patients move often. Let the sensors do the rest. Let the sensors do the rest. I only put this in because on the panel for the Health and Human Services of the state of North Carolina trying to delay the opening of gyms. The legislature did not listen to me or my associate pulmonologist. Our concern was you can have 10 treadmills 6 or 10 feet apart, and one person with COVID exercising moderately at about 100 liters per minute ventilation. Even in a reasonably sized gym, that's too much. So what the state of New Mexico did said, well, we believe that. We're just going to have everybody exercise aerobic with masks on. I don't know how this is going to work, but the thing I would ask, if you have patients going to a gym working out aerobically, I wouldn't, especially if you think they are at risk. Not until we get a vaccine or really feel like we're doing something wise in terms of incredible distancing with a very large open space of the gym. Finally, one last paper that was just published from Australia, just basically saying that intensive exercise, well above 80% of effort max, can be immunosuppressive and can actually adversely change thrombotic risk. So in this era of the COVID, what we're asking patients to do, stay in the moderate zone, and that's quite a spread. Moderate means anywhere from 40 to 60, 65% of effort max. That's plenty of room for improvement. Okay? So with that, it didn't leave too much time, but I think I can find questions on this platform here. Okay, good. So that's my wrap up. I'll be glad to look at any questions on the right here. Okay, let's make questions. Let's see. I guess I'm gonna. All right. You know what? If anybody's hearing background noise from my presentation, I apologize. Where I'm staying in Albuquerque did not have the bit speed or the transfer speed for this, so I had to go to a coffee shop, and I had for the time I did not have another option for a fast internet speed. So if you've got static or background noise, I really apologize. I hope at least the verbal part of my presentation came through. Let's see, I don't see questions down here. Again, my email address is rlaforge, that's RLAFORGE @nc.rr.com. Each of those slides have numerous notes. If we were just doing a regular PowerPoint, I'll be glad to send those to you. Okay, with that, I think we got another minute and a half. I'll look to see if there's any questions. So far, I don't see that.
So I see two questions, Mr. LaForge. One from Rich, yeah. One from Chris. If you, and one from Nada as well. If you click on question answer in the new sub-tab, you should see 3 that just came in.
I don't. Read them to me.
Okay, sure.
I'm sorry, I don't.
No worries. So from Richard Levy, how does stride length affect the study?
Okay, stride length only is relevant for trying to calculate distance. If that's important to you, yes, you can program most of these Fitbits and many pedometers you can input your stride length. But remember, stride length changes a lot, especially as variable terrain. Regardless of stride length, it's the foot strikes. I don't care if the stride is a foot long or 3 feet long. The foot strike's more important, but stride length does relate to the distance, not so much energy expenditure.
Thank you. Another question, do you have a particular step tracker that you think is the most accurate of all the ones that you've mentioned?
Oh my gosh, there's 100 cell phones out there. I would rather, if I was just measuring steps, using a 20-25 dimer, well-engineered pedometer, Omron, AccuSplit. There's half a dozen that have reputations. You can use the Apple Watch, but you're getting 10 times more things than you need to measure in terms from a health standpoint that's accurately measured. In terms of steps, I'm going to stick with that. Foot strikes or muscle contractions. The muscle contractions are the most relevant for a foot, not for interest necessarily, for just general interest, but clinically. Okay, so simplified pedometers are probably the best as long as they're well engineered. I'll be glad to give you a list. Actually, on the FNLA website, there's a link to a document that is that, but email me and I'll send it to you.
Wonderful. Thank you so much for that great presentation. We are going to now take a break for an hour, and we're going to return at 3:30 p.m. Eastern. Thank you all.
Thank you, Amanda. Appreciate it.